All right, well, today we're going to go over Caitlyn's other birth stories. You've already heard the one for the twins, but you have some other children as well, and have had 2 VBACs.
I do.
Yeah, so we're going to go over those today and get to know a little bit more about them. But you have shared some about them on social media.
A little bit, yeah. They were definitely supposed to be my redemptive births, and I do think that they were that.
Yeah.
Because, you know, my cesarean with my twins was a little bit traumatic. The anesthesia wearing off part and the sort of like uterine extension and all of that really like messed with me. So yeah, you know, when I was ready to get pregnant with my daughter, I was in the middle of midwifery school at this point. And it was not an ideal time to get pregnant. I actually remember my midwifery program was pretty harsh with me. I had asked my program director what like the best timing would be to get pregnant with like clinicals, and because we had, you know, our lecture like didactic stuff, and then we had clinicals. So I was trying to figure out what would be the best timing of like when to have a baby with all of that. And she basically told me, don't get pregnant. That would be a bad thing. And I did anyway, because, you know, we all have our reasons. My dad was had dementia, and I wanted him to meet his grandkids, like all of his grandkids, if I had any say in it. So I got pregnant in midwifery school. That's a whole other story. A lot of discrimination from my school during that.
Which is crazy because it's midwifery school. Like, they should be the most accepting of you getting pregnant while you're there.
Yeah. It's insane. It was like such a terrible experience. Like, people ask me all the time how much I liked going to Vanderbilt, and I always have to like bite my tongue a little bit, because I mean, earlier in school, before I even got pregnant with my daughter, I was pumping and all of that for my twins, and I was told like, hey, you're disrupting class by leaving class to pump. It's not fair to your, you know, your other classmates that, you know, they don't have a partner to practice with, because this is me leaving for literally 10 minutes once in the morning, once in the afternoon. That's it, all day. You know, just 2 times, and crazy. They were giving me so much crap for it. And I remember like leaving class like crying because of how it was like embarrassing. She'd like call me out in front of my classmates for having left to go and pump, and it was. And
they're supposed to be teaching like the new generation of like midwives who are like supposed to be helping people advocate for that kind of stuff in their life. So
yeah, it was wild. It was really jarring.
Yeah, but you did
anyway.
When
I was like pregnant with my daughter, they were trying to like limit how many hours I was going to get in clinical, because you needed a certain amount of hours to pass. And when I got pregnant, they do this like pregnancy accommodation anytime somebody gets pregnant in one of these programs that kind of just like, you know, says like how, you know, how your program has to structure things, you know, for your, you know, health, and for you to be able to leave for your appointments and things like that. And I remember as soon as my program director got wind of my pregnancy accommodation, she had me come in for a meeting. And in the meeting, she basically said, you know, because of your pregnancy accommodation, you're probably not going to get the hours that you need to finish clinical. And so you're probably going to have to repeat the course, and then that's going to push you back an entire year. And I was just sitting there like, are you like kind of threatening to like fail me from the course? Like, what do you mean I'm not going to get the hours that I need based off of this? And I basically told her in a kind way, well, I'm still going to keep it. Like, I'm not going to like tell them to take away my pregnancy accommodation. And then like the week later, the schedule came out and was completely changed, and my hours had been cut. And I counted up all the hours that I had for the rest of that clinical season, and I did not have enough to even hit the required clinical hours, even if I had gotten all of the hours that I was scheduled for as like active, because not all of the hours are active. If you're not like actively taking care of a laboring patient, then it's not considered an active hour. So I was only scheduled for like, I want to say, I mean, just like take a guess, like maybe I don't know, 300 hours or something like that, but I needed 350. And like, I'm like, even if every single one of those hours was active, I was going to fail. And so the only reason that I was able to pass was because I befriended some of the midwife preceptors that I had, and I had them call me in, you know, when they didn't have any students. And that was what was so crazy about it too, is that when I went to the scheduler and said, hey, like, I don't have enough hours to graduate. If I, you know, don't get some more, can you put me on for some extra shifts? Because there were a bunch of open shifts. She was like, no, it wouldn't be fair to the other students. And I'm like, well, the other students have plenty of hours, and it's only mine that have been cut. And also, there's all of these open days and all of them are reasonable. Like I don't have any appointments. I don't have, they don't conflict with my pregnancy accommodation or anything. So can you schedule me these? And she didn't respond.
Oh my God. They're like purposefully sabotaged you.
Yeah. Oh, 100%. I really believe that. I really believe that they really wanted me to fail the course because I wasn't going to be able to get enough hours. And when I found a way to get those hours kind of behind their back, I don't know if you want to call it that, but like behind their backs, I went to the midwives directly. I got the hours, and the day that I got all the hours that I needed to pass, they failed me for a different reason. So I ended up having to wait a year and come back a whole year later and recomplete all of it a year later. And it actually really jacked up my career and like starting out my career.
And like could have ended it. Like you're heading into maternity leave and stuff like that for a lot of people. You're a very driven person generally, but for a lot of people, I think that could have just completely ended.
Oh, for sure. And, it almost did. I mean, like I was in a really dark place after that, and I was very close to having my daughter. I was very pregnant at that time. And I thought for a long time whether or not I really wanted to go back or not. And I tried to maybe switch schools, like transfer credit. There was no option for me. I had to go back to this because it was almost like a principal thing. Like, do I really want to go and spend... Vanderbilt's very expensive. Yes. It was probably like $60,000 in tuition or something crazy like that to go back that extra semester. So I'm like, do I want to give this institution any more of my money after what they did? And so
then you're dealing with all of that anyway, and then prepping for a VBAC, which is what you ended up having. But tell us a little bit about like what you decided about not going for just a repeat cesarean. And why you decided that, and like your prep for getting your VBAC.
So there weren't a whole lot of places in the greater Nashville area that were going to accept really any VBAC, but especially not my kind of VBAC because I had this extension. And I moved from California, and the surgeons over there said that I could do a VBAC, but those weren't the surgeons I was talking to. So it's always going to be a different scenario when you're talking to, the provider that actually has to bear the brunt of the liability, right? So none of the midwifery practices or OBGYN practices really near me, there weren't any that were going to take on that kind of liability. So I actually drove a little over an hour away to one practice where this very well-known, just wonderful OBGYN, he's one of the only two OBGYNs that is kind of documented to have done like breech vaginal delivery. Like, that was a good sign. That was a green flag, like somebody who, has trained that way and has honored those requests from their patients before, and being one of the only two in the whole state of Tennessee to do that. I was hopeful that they would be supportive. And after kind of meeting up with them, he did have the recommendation of like, you should do a C-section. That would be like my professional recommendation. And I had the conversation with him saying like, okay, sure, but what if I don't? Will you drop me? Will you kick me out of the practice? Or, how does that look if I say I'm going to do a vaginal birth anyway? Because I felt comfortable with the risk, and I knew what that, surgeon who did my C-section said. And so he was like, yeah, it's fine. Like if you decide you want to do it, then we'll support you in that. He actually used that word, like, we'll support you, which was, surprising. And so I kind of just took that as like, this is what needed to go on paper for documentation purposes to protect him and to protect his clinic. But ultimately, he was very supportive. The midwives that I interacted with during my labor were really supportive. So that was nice.
Yeah. And I feel like that's something that a lot of people, like, even providers, but also just people need to hear is like, you can protect yourself liability wise. And if your patient still decides to do something that you don't want, you can still like be a supportive and helpful provider to them and help them stay as safe as they can, making the decisions that they are.
I think people would gain a lot more power in their decision-making abilities during pregnancy if they had a little bit of an understanding of like how all of this works when it comes to like liability and all of that. I mean, OBGYN midwifery is the most litigious, area of medicine. They get sued, like we get sued a lot, and it makes it difficult for us to continue practicing. And so it's not unreasonable, for OBGYNs or midwives to be worried about getting sued and to be protecting themselves. So if you understand that and you recognize that the thing that you want is just one of those things that makes your midwife or your OBGYN nervous, maybe for that reason, then chart it up, put it in my chart. You know, and that's kind of how I interacted with my OBGYN is like, oh, look, I get it. You know, you got to put in there that you've given me the recommendation not to do it, and I have declined.
Yeah, totally.
What are you going to do? You know? And it worked well because after we had that conversation, he really didn't bring it up much after that. We did have certain like kind of understandings though about it. So like we both understood he was not going to induce me. Right. And like there was not going to be Pitocin or, you know, any induction strategy being used because that doesn't make sense. If you've recommended a C-section to this person, now you putting, you know, giving them Pitocin and putting them at a higher risk of rupture. Yeah. So what that kind of meant to me was, okay, I've got until 42 weeks to go into labor on my own. I cannot get induced. And if I don't do that, then I have a C-section. Not only that, but I've got to go into labor and I've got to maintain that labor without needing any Pitocin or anything like that. Yeah. And, you know, have this baby 100% with my body's own natural forces, you know, and it does put it into a little bit of a different perspective when you think that way, because, you know, I think most people, you know, even with you, when you're having a VBAC, right? Like we can use Pitocin, we can use a Foley balloon, we can use certain things. But in my case, because it was like that higher risk VBAC with the extension and all of that, it put me in a position where I'm like, okay, I got to really hope that my body knows what it's doing and does it on schedule, you know? So yeah, my 40 weeks, you know, came and went, and I had my doula who flew out from San Francisco. I used to work with when I was a doula out there. She was there, and so I'm like kind of getting antsy, waiting for, you know, something to happen. I got a cervical check, and my cervix is closed and thick and high, and I'm just like, is this gonna happen? I don't know. And so I'll be honest, people aren't gonna like this, but I did use castor oil with this to get this going, because I got to about 40 and 5, and I'll admit, looking back, I probably could have waited a few more days, but I was just getting so anxious that I wasn't gonna. It's hard, and I was like, well, if I try it now and it doesn't work, I can wait another few days and then maybe try it again. And so it was to give myself a little bit of time. So at 40 and 5, I tried castor oil with the midwives brew concoction. So, you know, taking castor oil on its own oftentimes has a lot of GI effects that I've noticed. This is just anecdotal, you know, that people will take it, they'll have diarrhea or the runs or whatever. But what I've seen from my own clients who decided to take it on their own, you know, I've had people that I've told like, don't take castor oil, and then they would take this like midwives brew stuff. And it always turned out really well for them, and it kind of changed my view on castor oil a little bit. So
and you were someone who like you had worked as a doula and as a midwife, like you have a little bit more information on like what dosing usually looks like and stuff like that than someone out there who's
and
just
you know,
like
when
going
you
to
look
the grocery store and buying it and like downing a bottle because they're desperate to go to labor at 37 weeks. Like scary. That's a different situation.
And I mean, I've looked at the evidence for it too, and you know, we have there's some risks of like, oh well, maybe meconium, but then there's also the thought of like, well, preterm babies, meconium, pooping in the womb, is just a thing that mature babies do. Like it's a very physiologic thing that mature babies do. And oftentimes when people are using castor oil, it's because they've gone past 40 weeks, sometimes past 41. So those babies are mature. So is the incidence of babies pooping in the womb because their GI system's mature and they're passing stool as one would expect, or is it because of the castor oil itself? And ultimately the outcomes for babies are not very concerning. They're very comparable to when you don't take it, and it's been shown to be pretty effective. So I was comfortable with the risk, and that's really the name of this whole story. You know what I mean? It's like with my VBAC and with that and with other things, like, you know, I'm like weighing the risks and benefits, and am I comfortable with it, you know, or am I not? And so I took the castor oil with the, you know, the verbena tea and the apricot juice and the nut butter stuff. And it kind of does kick up some dust, but it doesn't like send me into full blown labor. And then it was, I think the next morning after I took it, and like I was kind of in a prodromally like weird, you know, not really full blown labor, not, you know, enough to like really let me get a good night's rest. But it was like in the morning that I think I saw a little bit of my amniotic fluid. Maybe it was kind of hard to tell. It was just like a little bit, but it looked like that straw colored amniotic fluid. So I didn't know if it was like, I don't know, you know what I mean? At the very end stages of pregnancy, like it could be discharge, it could be, urine.
Yeah.
It looked a lot like amniotic fluid, and it was one of those things that like it did not feel like I peed.
Yes.
But then over the course of the whole day, I didn't have any more leaking. And typically, when your bag of water breaks, you're just going to leak and leak and leak a little bit at least all day, and until your baby's born, right? But for me, I didn't really have that as much. It was like I walked through the mall with my doula, we tried to get things going, and there wasn't really any leaking happening. And then later in the evening, more contractions started to come, because usually, your contractions are going to pick up more at night when your hormones start to spike. So that's what was happening. The sun was going down, my contractions were starting to come back, and I had a little bit more leaking then. So I was really confusing myself, because I'm like, is this my water or is it not?
Yeah.
Like, am I peeing myself? Or is it my water? I couldn't tell. But anyway, that night I started to have more regular contractions, and they started to get more painful. And then into the early morning, they were like significantly painful and pretty, consistent, probably like 4 or 5 minutes apart. I got in the bathtub. They continued, 4 or 5 minutes apart. They were really difficult to cope through. And I will say to this day that, later on in the process, like how painful my contractions were at like 7-8 centimeters, I felt like they were comparable to what they were at home, which was surprising, because I decided I was going to go into the hospital, because at this point, if my water had broke, it had been a while. We like to have people really start labor by 24 to 48 hours after their water breaks. Sometimes sooner if you're showing any signs of infection, or if like you've had a lot of cervical checks since then, labor hasn't started. We want to see things get rolling. But at this point, it had been over 24 hours. And I was having these consistent contractions, and I thought, okay, well, I think I'm in labor. I might not be in active labor, but I think I'm in labor. And I kind of wanted to get to the hospital a little earlier, because I was a little scared for my baby. With like a VBAC, one of the first things that we see that tells us if like a rupture or some emergency is happening is an alteration in the baby's heartbeat. So I was monitoring my own baby with a Doppler at home, which, as a midwife, like I kind of know what to look for. But at the same time, I also knew that like I wasn't going to be able to focus on what was going on. I wasn't going to be able to focus on labor and also focus on my baby's heartbeat while I was monitoring them. And so I was kind of focusing more on the baby. And then I wasn't able to really like drift off into labor land, or like really get out of like my frontal lobe. So ultimately I was like, let's just go in. Let's just confirm whether or not my water's broken, get the baby on the monitor. That way I don't have to worry about monitoring my baby anymore. And that'll make me feel at ease. So we went to the hospital, got checked in, and I was like 2 centimeters dilated and like 80 or 90% effaced. I want to say I was very effaced. And I remember being so disappointed, because I had been laboring for hours and hours and hours at home, and they were consistent and really painful. And I was like, how could it possibly be that I'm only 2 centimeters dilated? And it's so funny, because, as a doula and as a midwife, like someone who went from clothes thick and high, completely, not dilated at all in the clinic just like 2 days before, who's now at the hospital like 90% effaced and 2 centimeters. Like, you've done a lot of work. But in my like, not midwife brain, as like this patient and I'm in labor and all of that, like it was so crushing to feel like, oh, I'm only 2 centimeters dilated. And I was kind of convinced that this wasn't going to go very well. That I wasn't going to be able to get to, 10 centimeters, because another big feature of this labor for me was that I was pumping and stimulating my nipples a lot to get contractions going, because pumping and all of that can cause contractions to come, and it was a very effective tool for me. So like I was using that really the whole night until I got into the bathtub, and when I was in the bathtub, the contractions stayed consistent, so I felt good about that and thought I'd come in. But by the time that I got into the hospital and they were now checking me at 2 centimeters, my contractions had completely went away. And then part of that, I think, was because it was the early morning, right? It was like 6 a.m. when I showed up to the hospital. So contractions had completely disappeared. I hadn't had one like the whole time that I was in triage. And they came back to tell me that my ROM plus thing was positive, that my water had broken. Now, fast forward a few years, I don't know for sure if I believe it anymore that my water had truly broken, because ROM Plus isn't always super accurate. And I didn't really leak anymore throughout the whole rest of the labor. So it's still kind of confusing to me whether my water was broken or not. But regardless, they thought my water was broken because of that, and they admitted me. And again, contractions nowhere to be found. I didn't know what to do about that. I was like, well, let's just start pumping again. So I'm essentially just like pumping the whole time. And every time I pump, like I get some consistent contractions. They're painful, but like not as painful as they were in the bathtub. Yeah. And they weren't sticking around. Every time I got took the pump off, they'd go away. And it was super discouraging because, we tell people, like true labor, you're not gonna be able to scare it away. Right. Like it's just gonna happen.
That being said, when the sun comes up, it's like it's such a real thing where I see so often people will like present like they're in active labor, and they like get to that point from midnight to 6 a.m. just like you, and then as soon as that sun comes up, labor is like la 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 la. Like even if you are dilating and like making change at night, it's so normal for it to go away during the day.
I really feel like people look at me and they think that I'm making that up or something, or that's like some sort of like witchy, like not real thing. But it's so real. It's not just the sun too. It's also just going into the hospital and being around strangers and being in a new environment, being distracted.
Right. You had a lot of things.
I mean, I was distracted, and I was anxious, and I was like, oh, I'm only 2 centimeters, and I had all these doubts, like I'm not gonna, have my vaginal birth. And so I think a lot of it could have been that I was very much in my head. I was very anxious. I was staring at the monitors, watching every contraction that was coming, and then having to pump to keep my contractions around. And so I went through the whole day. What was really nice about that though is that I didn't have to get any cervical checks. My midwife was just very like, she just kind of let me be, which was really nice because my water had already been broken for forever, right? But she just kind of let me be. And so we just worked on getting those contractions to come back, and at no point did they ever stick around, and it was driving me absolutely crazy. And eventually, I want to say maybe 6-7 p.m. at night, I'd been there all day, she wanted to finally do a check on me, and I was like begrudgingly like, okay, but I knew that it was going to be no change, because I just was like, I've just not had enough strong, consistent contractions to make any change. And she checked me at 7 centimeters, and that like blew my socks off. I actually cried, I think.
I'm sure.
Because I was totally convinced at that point that I was having a C-section, and that I would never experience a vaginal birth ever in my life. And I was so sad about it. And when she said 7 centimeters, I cried, and I was just like, saw the light at the end of the tunnel. And so she could feel like a bulging bag of water. Again, my water had broken, so that was a little surprising, but I told her, I was like, go ahead and break that and let's see what happens. So she breaks that, and then my contractions still don't become consistent.
Crazy.
I'm 7 centimeters dilated, and they're still like super spaced out, or like not coming at all. So I was pumping at 7-8 centimeters dilated, trying to keep these contractions around after she broke the 4-bag. That's what they call it, the 4-bag of water. So she breaks that, and like, I'm still working to do that. Anyways, one of my birth plan things was that I did want to get an epidural, not because I needed it, but because I knew, like, I've seen so many people give birth unmedicated. I knew that I could do it, but what I actually wanted was, I wanted to not really feel the like ring of fire, and like I also wanted to be able to focus on like time with my baby after my baby was born, because I imagined that if I got my vaginal birth, it'd be really a special moment for me, and I didn't want to focus on any of the pain of like having to be sutured up, or the pain of like if they had to go and do a uterine sweep or something like that. So after a couple hours of like pumping and trying to get the contractions to come back, and I was able to get them to be consistent and super strong when I was pumping after my water broke. So after a couple hours, I was like, okay, let's go ahead and just get the epidural now, so that it has time to take effect before I reach 9 centimeters, because I felt like I was probably getting pretty close. And so they do that, and then like literally the second that they like reposition me after the epidural, I feel that baby just like hit my pelvic floor. Like I was like, it's go time. And I felt like that urge to push, which a lot of people don't feel with an epidural, but I don't think that my epidural really had the time to like really take effect. And it didn't take full effect, which is perfect, because that's what I wanted. I told them that I wanted the lowest dose possible, so that I wouldn't maybe have as much of a hard time pushing. So yeah, we were, ready to go and started pushing. And let me tell you, I think the most surprising thing as somebody who'd never given birth vaginally before, who works, as a midwife and in this field or whatever, is how awful pushing was. Like purple pushing. I really did not think that was that serious. Like like when you have an epidural, I'm just like obviously when you don't have an epidural, like it's intense,
totally.
Obviously. But when you have an epidural, I'm like, the actual act of pushing was miserable. It was so miserable. Like I was pushing so hard that it was making me feel like I was going to pass out every time.
Yeah.
And it made it just like all the pressure in my head.
Yes.
And it was just, I just remember being like, this is so shitty.
Yeah.
And so, but I was giving it my full pushing purple pushing effort. And I was like doing the hands and knees and doing all this stuff. And we did make some pretty quick progress. And yeah, right around the time that she's crowning, you do feel some pain.
Definitely.
With that. It was like as soon as she kind of got to that point where she was like her half of her head was crowning, I feel like you can start feeling that sharp pain again because it's so low. The baby's so low that your sacral nerves can't cover. Like the epidural medication doesn't cover those thick, like super low nerves. And so, yeah, I wanted to get her out as quickly as possible, but you got to keep it controlled. And she comes out and I didn't tear and it was amazing.
What was that moment like when you feel her head, she's under that pubic bone and you're like, I'm getting this vaginal birth?
Well, I mean, I don't know. I think I didn't really feel that like I did it until she came out, because I've seen, and as you've probably seen many times before, so many times where it doesn't even matter how close you are. People can have a C-section even when the baby's crowning, stretching the perineum and everything. So I was not getting my mind in the place of like, I'm going to have this vaginal birth like I wanted until she was out. And of course also like with a C-section, you don't get that moment where you reach down with your hands and pull the baby up to your chest. Like the baby is taken out and they're whisked off to a warmer typically. So, I've seen that moment hundreds of times before with clients where they, they reach down, they pull the baby up to their chest. And so none of it was real until I actually reached down, grabbed her and pulled her up to my chest. And like, it was in the act, like almost the muscle memory of doing that just from watching all these other people do it. And I'm like, now I'm doing it myself, that I like broke down crying and, I just felt so happy. Like it was the most perfect birth and it was absolutely redemptive. I was so excited about just the fact that I wasn't going to have to be a midwife for the rest of my life and not know what it felt like to have a vaginal birth. Because I mean, I got the C-section birth, so I can relate to people who have a C-section. That's 1/3 of all of my patients, but the other 2/3, like I would never be able to relate to them. And once I have that second, C-section, I would never really get the opportunity to have a VBAC again. There would be no physician or, midwife practice that would support me probably, unless I went at home, which is something I probably wouldn't feel comfortable with. But yeah, it was wonderful. And it was nice. The epidural, it significantly, improved the pain, which is something that I knew at the time, but I also didn't know to what extent until I had my next VBAC.
I think it's really common that people, and not that they're like always incorrect about what they're thinking, but people often think that their epidural didn't work because they felt so much during pushing and they didn't like realize it. But then if you have a fully unmedicated birth, then a lot of people are like, oh, actually my epidural worked great and I just thought it wasn't working because I felt a lot. But unmedicated, you feel a lot more.
For sure. And it's one of those things too, like my epidural, I remember, was very much like one-sided a little bit. Even on the side though, where like there was pain and it was, I don't even want to downplay. Like, it was intense pain and like I was not happy about it. You know what I mean? But yeah, that pain in comparison to the unmedicated birth was just so much better. And one reason that I knew, because I didn't really know any of that while I was pushing or while I was feeling all of that pain, and then especially like the pain when the baby crowns and it's like, you're not getting that full coverage because the epidural can't cover those nerves very well. It wasn't until afterwards my midwife actually did a uterine sweep. That means she puts her hand in and she like scrapes the sides of the uterus. And also I had her do what's called a post-placental Mirena insertion because I wanted a Mirena IUD. It's like the secret menu of midwifery or something. People don't talk about it a lot, but you have the option to get an IUD inserted immediately after your placenta comes out. But I've always had really terrible IUD insertions ever since my twins. I think there's like scar tissue or something. So I told them that I wanted that, and it worked really, really great. She just put it up in there, but that meant that she put her whole hand in my uterus, in an organ. The uterus is a sterile, organ inside. And so, she did that. And I remember it feeling like a lot of like jarring, like pressure, like it felt super weird and terrible in a different way, but not painful. It wasn't sharp pain. And so then I realized I was like, working. That was like, how crazy must unmedicated birth feel like if I was experiencing pain when my daughter was crowning, but then she can put her entire hand into my uterus and it doesn't hurt.
I will tell you, when I like started being a doula, I was kind of like, well, maybe like one day I'll like think about midwifery school or something. And the day that I saw a midwife do like a manual extraction of a placenta, not even just a sweep, but like an actual manual extraction on a home birth client who was completely unmedicated, that was the day I was like, oh, and that's not a job I'll ever have. I was like, that's not for me. No, thank you.
I don't blame you. I think if I had to do that, but that's the thing, is that you do sometimes, very rarely, have to do that.
It was an extreme
client if you were a home birth midwife. That's honestly, it is those types of things that make me feel happy to be currently working in a hospital. Totally. Because usually people are epiduralized, but there are situations where somebody without an epidural would need that, and it's
extreme situation, but definitely something I was like, I'm good in my non-medical role, actually. Turns out.
But it does make sense though why that would essentially not hurt, my situation, because I had an epidural that was working for the most part, right? It makes sense why that wouldn't hurt the same way that crowning would, because like crowning, those nerves down there at the very opening of the vagina or whatever are kind of like at the lowest spot, and a hand is much smaller than a head, so like that part of the body's not being stretched significantly more than what it just was. It's like the organ pain that epidurals cover really well.
Yes, definitely.
And so the part where she was like scraping the inside of my actual uterus, that didn't hurt.
Great. And then what was your postpartum like? Like you had, the twins were in the NICU and you had a very different postpartum experience with them. So then what was it like to have your baby with you, or was she with you?
Yeah, she was. It was Lorelai, her pregnancy, her birth, besides the fact that the labor was super wonky and weird, and I essentially had to pump my way to 10 centimeters. Her birth and postpartum were all so normal, like jarringly normal. Like, what is going on? I was not used to it. I was used to seeing my babies every 2 weeks on ultrasound with the twins and everything. Totally. You get that one ultrasound the whole pregnancy, and it was like so normal. And breastfeeding her went well, and I mean, she was just a healthy, happy baby, like no issues whatsoever. And I do remember at the time my husband was in school full time, and I had been in that terrible situation with my school, so I didn't have anything but my company to worry about until I went back to clinical when she was like 8 months old. So it was just me and her every day, and I took care of her at night by myself. I took care of her during the day by myself. We were completely inseparable, and it really, I mean, me and her got very close. And it was honestly just such an amazing experience, and in comparison to like how rocky the road was with my twins, it legitimately made me want to have another baby, just like having her. And I remember too, like even like after she was born, within like the next 20 minutes I was like, I want to do that again, which was like such a weird thought. Like that crossed my brain, and I'm like,
it's weirdly common that people feel like that, like right after they give birth, that they're like, oh, that was really cool, actually.
When you have a good experience.
Yes, totally. Yeah. Sweet.
It was wonderful. And so, then I decided we are going to have one more baby. And so, we had our little boy, I think I talked about in the last episode that we did IVF. And so he was our sole embryo that was healthy and genetically normal. And so I was really nervous because, like I said, after having Lorelai, my daughter, with that VBAC, I really did just want to have one more. Like, I wanted to do pregnancy again. I wanted to take care of a sweet baby again. Like, I just wanted one more. I just felt like there was like a little hole in my heart that was just going to be filled by just that one last baby. But I only had this one healthy embryo, and if it didn't stick, then I was going to never have another baby. So that would have been really hard for me. And so we did, the embryo transfer, and it stuck, and I was just so elated, so excited. And then again, just like a totally normal pregnancy, nothing abnormal about it. So it was so weird. It was like I front loaded all of my complications with that first pregnancy, and then my next two were just super normal, even though I couldn't fully feel like a totally like low risk pregnant woman, because I had this scar, and it was always a topic of conversation. I feel like anytime that I was, getting an ultrasound done or, at my doctor's office, like that was like a little bit of a dark cloud that floated above my head. But overall, like super normal pregnancy.
Was there any pushback on you having a VBAC that time after you'd already had a successful one, or did that kind of like quell the fears of medical staff?
A lot less. Yeah, there was significantly less nervousness. Yeah, because I do remember with the first VBAC, my doctor said that they had like a team meeting, because whenever you're in practice with a bunch of other people, you can't go and just take whoever you want on as a client or as a patient, because any one of your team that's backing you up could be the one stuck with that situation. If they're not well trained in that, or don't feel comfortable with that, then you've put them in a bad situation. So he had to go and kind of talk to everybody about my situation, and not everybody at that practice felt super comfortable with the things that we were planning on doing, the VBAC, but also the Mirena insertion. Some people didn't know how to do that from school. You learn it in school, but I guess they hadn't done that since they were in school.
Interesting. Yeah.
So this second time around, everybody at the practice was a lot more comfortable with it. My doctor brought it up significantly less.
Yeah.
We were kind of on a mutual sort of understanding, and he was like, same plan. We're not going to use Pitocin. We're not going to do a Foley balloon or anything like that. You got to go into labor spontaneously. But now that it's you've had a successful VBAC, we know your body can do it. So it was a lot more relaxed.
Yeah. So then leading up to the birth, were you kind of planning like a similar experience? And then how did it go when you actually labor started?
Yeah, I would say so. The thing is that, like I said, I'm like, I had my C-section, and then I had my vaginal birth, and with the epidural or whatever. So there was a big part of me that was like, maybe I should do it without the epidural this time. That way I've like experienced all of it. And like, I also feel like people look at midwives and they think, oh, you're having your baby at home, obviously,
right.
They kind of like make a lot of assumptions about
definitely.
them. And so just to be able to almost appease those assumptions, or just like not have to always explain myself when that got brought up, like, oh, how did you have your babies or whatever? And then I had to go and explain, because the thing is that, like I said, I knew I could have an unmedicated birth. I didn't want to, right? Like that was not my desire. You know what I mean? So having to explain that to people forever, that I chose not to do it that way. Like, I'm like, oh, well, maybe I should do it without the epidural this time. And then that way I sort of meet the expectations.
Yeah, or like the assumption that getting an epidural is like because you doubt your own ability, instead of being like, no, I just like want a different experience. It's okay to want something different than having no pain meds and like going through all of that.
Yeah. And people on my TikTok have made that abundantly clear, that
I'm sure
they think that the reason that I choose this and that or whatever, or like whatever, pain medication, is because I couldn't handle it. And it's like they heard, I think with me having my daughter, I got my epidural at like 9 centimeters. Yeah. And so they were like, why not just not do it then? You were so close. Yeah. And I'm just like, because it's not how I wanted the end of my birth.
Yeah.
Like, I didn't want to feel the ripping and tearing. I didn't want to feel the stitching. Yeah. Like, I didn't want to have to worry about any of that when I'm trying to bond with my baby. Like, I want to be able to look into her eyes and just soak all of that in.
Totally.
And so that's what I wanted. So anyways, this time I was kind of thinking maybe I should just do it without the epidural, and then I like clocked myself and was like, wait a minute. What do I actually want? Because I've always advocated for people to do whatever it is that makes the most sense for them, whatever it is that they want, and do it unapologetically. And here I am considering doing something different than how I want to do it, just for the sake of something that's really not a great explanation, like not a good reason,
right. Yeah.
And so I was like, I'm just going to do what I wanted. My last birth was amazing. I loved it. You know, it was awesome. I got to experience labor. I got to experience arguably the hardest part of having a baby, like childbirth. A lot of people will describe like transition and that period being like the most intense. And I got to experience all of that. And so I was like, let's just do it the way that I want to do it. And I'll do it the same way again, where I'll postpone the epidural till almost the very end.
Right.
And get it right at the end so that I don't have to worry about the after parts being distracting from my baby. And so, yeah, this time I did not take castor oil or any other thing. I just actually was trying to extend my pregnancy as long as I could because I had another doula friend flying out from California for this birth. And she wasn't just going to kind of be a supportive person there. She was also going to take some videos of my birth, which I was really excited about, especially because, you know, I share a lot of that stuff on TikTok.
Definitely.
So she also makes videos. Her name's Dawn. She's Nurse Dawn on TikTok. Pivotal Birth, I think. So she's also makes videos, so I knew she would know how to like get the right angles and stuff like that. So I was like hoping that was not going to that I was not going to go into labor before she arrived. Anyways, I get woken up one morning at like, I want to say, how many weeks was I? I was like 40-1. I want to say like maybe a day after my due date or
like
something,
right around due date time.
It was right around due date time, I think. I can't remember. But yeah, I should probably remember that. It was literally 4 months ago. But
that's why you can't remember it. Your brain is like, no, that you don't have access to that right now.
Just scrubbed from my memory. But yeah, so I wake up. I'm woken up at like 4 a.m. in the morning by contractions, and I'm like, ooh, that's not a good. That's not a good sign. You know, usually you might have some contractions, but you know, if they're waking you up from a sleep,
it's like maybe it's baby day.
Maybe this is the real thing. Yeah, and so I noticed like I start timing them early in the morning, and they're like 8-9 minutes apart, and they're consistent. So like, you know, that's also not a great sign if I'm not wanting to be in labor yet.
Yeah, all the things that people really want. Usually, you're like, uh-oh.
Yeah, I just needed it to wait like 3 more days. That was what was so. I was like,
come on,
I can't go into labor right now. I just needed to like hold off for 3 more days. And so yeah, 8-9 minutes apart, painful, and I was like, okay, well at least they're kind of spaced out,
right?
And so I get up and they kind of get a little less painful, you know, throughout the day, but there's still like enough where I'm like having to kind of like I'm not able to just ignore them. Like they're kind of like raising my heart rate when they're happening, even if I'm able to like distract myself away from thinking of them. But they kind of stay consistently 8-9 minutes apart. And so I had a job interview at this point, by the way. This is so great. This was like a really crazy timing. This was back when I was working at my very first job. It was like, you know, I was working at this home birth practice, and you know, that whole thing sort of like blew up. There was some crazy stuff that was going on with management. All of the midwives decided to quit at the same time, and it left me as the sole midwife who hadn't quit yet. And so I quit along with them because I needed them, you know. I needed backup. I needed good, like a good team to help sort of teach me and orient me to home birth midwifery, because that's not something we learned a lot in school. That whole practice just crumbled right as I was going on, like about to go on maternity leave. And so I was scrambling to try to get another job. So I actually had like an interview that was set up for that day, and so I decided I was going to go anyway.
Proof that you're committed, you know.
I really went back and forth on it. I was like, you know, but I'm like, if I have this baby, when's the next time that I'm going to be able to go on this job interview? Like, I'm going to miss the opportunity to get this job. So I just went, and I remember like doing the math, like, okay, 8 minutes apart, if it's like an hour, like that'll be like what, 7 contractions
you're like,
or something. I just need to make it through 7 contractions in this interview. And I was sitting there and they were happening, and I like, because I didn't tell them that I was in labor, because they obviously would have been like, no, we should cancel this interview.
You're like, just give me a second,
like I wasn't
breathing through.
But I was like, I remember I was like sweating.
You're like, I'm just thinking really hard about this question.
Well, because it was very conversational, like especially a lot of interviews for midwifery positions are a lot more like, you know, how do we jive kind of thing. And I don't think I jived very well, because I think I was just like, I was in pain and I was distracted, and I was like, am I listening well? Like, did I hear what she just said? I wasn't I definitely was not on my game. So I did not get that job, believe it or not.
They're like,
but
she had a really weird
I went
vibe
home
during her interview.
I know, she just seemed like she was uncomfortable.
Yeah, she seemed
something.
like not paying attention to us or something.
Why was she's so sweaty.
Yeah. she was really nervous, it looked like.
Yeah. So yeah, that didn't work out, but it's
All
okay.
good.
It went well because I ended up getting a great job later.
And you know
But,
what? Good distraction,
no,
honestly,
so I went home.
so it's fine.
Yeah, that's right. That's what I did all day. I distracted the heck out of myself. I mean, those contractions, they did not stop all day. They were 8 minutes apart and they were painful. And they were getting like very slightly more painful throughout the day. Like by the end of the day, they were, a lot more intense. But they were still 8 minutes apart. So I was like at home in the end of the day, and I was just like, this is so weird. And so I was like, well, I guess we'll go to bed and we'll see if they'll go away.
Yeah.
And so I go to sleep probably like 8, 9 o'clock, or not 8, like 9, 10 o'clock.
Yeah.
And I was able to get to sleep. And then at midnight they woke me up again, and they were a lot more intense. And then they were still like 8, 9 minutes apart, which was weird. And so I was kind of just like trying to fall asleep in between, and then they'd wake me up every single contraction. And that went on for like 3 hours. And part of the reason why I think I let that go on for so long, knowing that like these were like, it's weird that they're painful enough to wake me up, like it's got to be labor, it's got to be the beginnings of labor or something, is because my husband was sleeping and I was like feeling weirdly self-conscious about waking him up. I'm like, look back on that, I'm like, that's
you're
so
like, we've
stupid.
had 3 kids together, probably it would have been fine.
Yeah. Well, I love him to death. He's not, this is gonna make him sound like such a bad guy. He's not a bad guy. He is wonderful. He had a spinal cord injury, and his sleep is a little weird ever since his spinal cord injury. So he does get a little bit like protective about his sleep. So I didn't want to wake him up, and I was worried if I woke him up that he wouldn't be as supportive. Like if I was thinking like, if I could just make it to the morning,
or that he'd just be like exhausted
more,
and not supportive in the way that you like, need in that moment where someone's like, yes, we're here.
Yeah. The spinal cord injury like really makes him cope very poorly with not having sleep, because his body doesn't work very well already. So when he doesn't get sleep, it works even worse, and he's in a lot of pain. So anyways, that being said, I didn't want to wake him up early, but then 3 hours are going by and I am in this like twilight state, like just misery. I'm just so miserable because it's just like they're not getting closer together. They're super painful, but like I felt like I was making no progress, and I was getting so discouraged and broken down, and I felt alone. It was, dark, and I felt like I was like a little bit drowning. And I was like, that's not normal. I shouldn't feel like I'm drowning if this is early labor. But they were still super far apart, so that's what was confusing me. So anyways, I just got fed up with it, and eventually I woke him up, and I was just like, whatever's happening right now, I can't do it anymore. So I need something to change. And I was thinking, well, maybe, if I wake him up, he'll convince me to get into the bath, because that was another thing that was happening, is like in my brain, I'm like, I should probably get in the bath, or I should like walk around, or I should do something. But I was in so much discomfort, and I was so like just pitiful, I feel like, that I was not going to be the one to force myself to get out of bed. And I really realized in that moment like how great doulas are for that, because I just needed somebody to like not just force me out of bed, but to draw the bath and to like get me into the bath. You know what I mean? Like I was not going to do it for myself. And so, but then after 3 hours of that, I was just like so miserable that I woke him up and was essentially like, I need a change or something. And he was so funny, he pissed me off. He was like, he's like, so what do you want to do? And I'm just like, I don't know, I just need a change. I remember I started crying, and then he's like, well, why don't we try to go back to sleep and see if that works? And I got so pissed.
You're like, no, wrong answer.
I don't want to go back to sleep. I'm like, do not say that again.
You're like, I need you to suggest to me the things that I already know that I should be doing, but you have to say them.
Yes. And that's kind of what I told him. I was like, I need to do something different. Like, tell me what to do. Like, and he was lost. He was just as lost as I feel like a man would be that has no idea what's going on. So he was just like, are you sure you want to go back to sleep? And so I was just like, let me just like move around the house and you just squeeze my hips, okay? And so I'm, doing that stuff. And literally, I want to say within 30 minutes, no exaggeration, 30 minutes of just standing up, my contractions went from 8 or 9 minutes apart, which they had been for like ever, like almost 24 hours at this point, to, it was, I think, a minute and a half, like 2 minutes apart.
Wow.
Like within
Fast,
30 minutes,
yeah.
just completely closed the
Yeah.
gap. And so I was timing them because I had my TENS unit on. My TENS unit has a little contraction timer on it. So every time I was using it, I was seeing my contractions getting, how close they were now.
Yeah.
And I didn't believe it. It took me a solid like 10, 15 minutes of just consistently every 2 minutes for me to be like, oh, I think these are actually like, I thought they were maybe like little one-offs, but no, they were sticking around that way. And then I was like, like 45 minutes after I woke him up from his sleep and he was trying to convince me to go back to bed, I'm like, we got to go to the hospital. And he's like, are you sure? And I'm like, they're 2 minutes apart. They're painful. I'm pretty sure it's time. And so, we get to the hospital. They check me in and I'm 7 centimeters in triage. So I'm like, whoop, whoop. Yeah, super happy about that. And my husband was like, oh, shoot. Yeah. You must have been doing some good work at home. Yeah. And
you're like, say sorry for saying I should go back to sleep.
I know. Oh, definitely. I definitely rubbed that in his face. I was like, if I had gone back to sleep, you would have been catching this baby at home. And so the nurse was like, do you want an epidural? And I was like, I do, but I don't need it like right away. I just, probably that was stupid to say.
Risky. So risky.
She was, because I was already 7 centimeters and who knows how long I was making any real change, because again, these contractions were just super
you could have
spaced
been
out
like
the whole
3
time.
centimeters until you felt them switch to being like 1 minute apart.
Yeah, who knows?
And like, it's such a thing that, I mean, obviously you're in your like labor brain, but like as a doula, if I had a client who wanted an epidural and you've had a baby vaginally before, if you're anything above like 4 centimeters, I'm like, get anesthesia in here right now, because it can just happen so fast. So the fact that you were like, I'm okay for now at 7 centimeters, I feel like everyone listening who like works in birth stuff is like, uh-oh.
Yeah, I was like, I was like, I'm doing fine right now, and like, probably would want one soon, but no rush. And she was like, the nurse like got the anesthesiologist on the phone like immediately and was like, yeah, we're gonna want one. And so she didn't listen to me. Yeah. She was just like, she knew, and she was right, because we get over to the room, and the freaking labor and delivery unit was hopping. Like, it was so busy. I was looking on the monitor and I was just seeing like room after room after room. I'm looking, because you can tell, we can both tell like when someone's pushing, their monitoring strip looks a certain way. And I'm seeing all these people, like multiple people pushing, multiple people with very consistent contractions happening. And so that day was a bad day to have a baby. It was actually funny because I think we showed up like close to 4 or 5 a.m. in the morning, and there was a woman probably about 20 steps in front of me who was also pregnant, in labor, having a baby, and apparently someone had given birth also in triage after me. After I had gotten into a labor room, I was like one of the last people that got a labor and delivery room. She was like 20 steps behind me.
What was going on
in the triage room?
The stars, the moon, whatever. There was something was happening. It must have been a full moon
or something. At some point, I think I was in my labor and delivery room for like 2 hours, 2.5 hours maybe. And so you would think that in that time that the anesthesiologist would get their little butt on over there, but apparently they were in the same room I don't know, this is at least what my nurse seemed to make it seem like, is that this anesthesiologist was in the same room with the same patient for that entire time. Like, and they just had a super difficult being 7 centimeters or something,
but dang.
Or maybe there was some sort of like emergency and they just didn't want to tell me about it. I don't know. I didn't want to share any patient information or something. I was laboring, in the room, and I had like nothing outside. I had a TENS unit, and my husband was doing like a hip squeeze here and there, and half of them hurt. So I'm like, stop doing the hip squeezes. Like,
unfortunately, the partners are never doing the hip squeezes, right? It's just such a thing. Unfortunately, I don't know what it is, but it's like the energy of just being somebody who works in birth. Like, even when I was a fresh doula, I would like get all the time of people being like, no, you're doing it wrong to their partner, and being like, come back,
Have
Joe.
her do it. Yeah.
It's like in your blood if you're a birth worker.
No, that's what this was like with my nurse. My labor and delivery nurse did a few hip squeezes that actually were incredibly helpful.
Yeah.
And I was like, oh, that's what a hip squeeze is supposed to feel
Yes.
like. And she did that, and then he did one, and I'm just like, no. I'm like, have the nurse. I remember telling him, I'm like, have the nurse show you how to do it.
Yes.
And so his hip squeezes got maybe a little bit better after she showed him, but for the most part, she was gone, and I was just in that room going through transition.
Yeah.
And I remember transition hit me like a ton of bricks this time. The last time, I think it was because I was just so intent on like getting my contractions to happen and to be closer together that like I don't know if that was like clouding my interpretation of how bad transition was.
Yeah.
Because every contraction I like wanted it so badly with the first baby, but this time I didn't have to do anything to get these contractions to come.
Yeah.
And there was nothing I was doing that was slowing them down.
Yes.
So it was very, very intense and just 100 times worse than what the first labor felt like.
Yeah.
And I do remember being angry at first because of how long it was taking my anesthesiologist to get there.
Yeah.
And just being like, yeah, you know, this is definitely transition. And I'm just like drowning, you know.
Yeah.
They were just, I mean, just indescribably painful.
Yes.
I mean, contractions, I feel like during labor up until this point, I almost feel like I could describe them pretty well. Like they were very much just like almost like a hot, like searing, cramping pain that just radiates from your back like to the front and like down your crotch a little bit, but like just like the searing like heat of it almost, like just so intense. That's what labor felt like for the majority of labor, just that, but more and more intense. Right. But then in transition, it's like it became indescribable how awful they were. And I just remember like wanting to just punch the bed over and over again because I was so mad that my anesthesiologist wasn't there yet. And I remember thinking that just predictable thing that everyone says in transition, I can't do this. Like it was there. Yeah. And it didn't matter how many times as a doula I have heard other people say that, or as a midwife, I've heard other people say that during transition. And you always respond the same way. Like, you can do this. You are doing it. You know, you're strong. You got this. You're safe. Like all those things or whatever. And so even though I've been the one to say that, and I've seen so many people have those, you know, that thought and say that thought out loud, I had that thought come into my brain and there was no way of getting it out of my brain. Like it was there. It didn't matter how cliche it felt, that of course I'm having that same thought that everybody else has had, but it was there. And I'm just like, I wanted to say it out loud so badly, like I almost took over my free will. Like I wanted to like just say like, I can't do this so badly, but I didn't, because I knew that if I said that around anybody who knew birth work, they were going to go and tell me all those same things that I've told other people, and it was going to piss me the hell off.
Like, I don't want to hear that I'm already doing it. I'm very aware of that fact. Yeah.
I know. That's exactly where I was. I was like so much more aware than I thought I would be at this, like in this particular stage of labor, because I was like, I can't do this, but I can't say that out loud because they're going to tell me I can. And yes, I can, but I don't want to. Yeah. Where's my anesthesiologist? And I was just angry. Yeah. And I was also very scared because I knew how close I must be getting. Like I was very aware of the fact that at some point very soon it was going to be too late and my baby was going to be in the birth canal ready to come. And so I was kind of grieving. Like that's probably the best way that I can describe it. Like I was grieving the birth experience that I wanted, that I had expected, that was going to mimic my last one. And coming to grips with the fact that I was going to feel everything, especially because I didn't even have nitrous. I didn't have any other resources. The only thing I had was that TENS unit, which had stopped working at this point. Worked super well up until transition. And then it basically, I remember thinking like it was very intense. My TENS unit's very like noticeable. Like, you can turn it up super high too, but in transition it was up on the highest setting and I couldn't feel it.
The intensity of transition,
what was that about?
So much of that kind of stuff, people are like, okay, this was really helpful until this point, where like you can be doing the best coping
seemed like
strategies
a magic
and things
trick.
like that, and then it's like it just overrides everything in your brain and body, and you can't pay attention to anything else.
But like it really did seem like some witchcraft, like some tomfoolery for real, because I was just like, I had this thing on and it was so noticeable and so helpful. So helpful. 7 centimeters, like into my labor room. And then transition was happening, and I was looking down at my TENS unit wondering if the thing had ran out of battery, or like if it wasn't on anymore. And it was on and it was full steam, and I literally could not feel it. Like my sensations couldn't pick it up.
Interesting.
It didn't exist. So that was a little scary. I was like, oh gosh.
Yeah.
Like I'm in the thick of it now. You can't go over it. You can't go under it. You gotta go through it. So I was coming to terms with the fact that I was about to have this baby fully unmedicated, and that was going to happen. And you've seen birth enough times, and you know what it looks like down there, you know what I mean? You know how big that stretch is, and I'm like, I'm gonna feel that. Brace yourself, you know what I mean? After probably being in transition for maybe a good 45 minutes or so, I could feel my body starting to push, I guess. And it honestly just started feeling like I was holding my breath, but like I didn't know why. Like it didn't really feel like I was pushing, but I just noticed that I was holding my breath. And then I was like, oh, I think that I'm pushing right now, but I didn't want anyone to know, because I didn't want...
You're like, just in case anesthesia's in the hallway, I'm not gonna say anything.
Exactly. I was like, if they don't know that I'm pushing, they'll give me the epidural. So let's pretend.
Not because I'm pushing. That's just how I'm coping right now.
I'm just trying to be quiet.
I'm just really calm because it's not that intense and it's completely fine.
I was super loud a minute ago and now I'm dead silent. But she didn't know. Nobody knew for like probably 15 minutes that I was like not uncontrollably kind of bearing down a little bit. And then that sensation got significantly more intense, to the point where I'm like, now she's gonna know. And I'm like making the noises that people make when they start to bear down, and I'm like waiting for her to be like, are you pushing? And first I didn't answer her, and because I'm still like stalling. And then eventually she asked me again. She's like, honey, are you pushing? And I was just like, oh, fine. No epidural for me. There's no chance of it. And I'm like, yes, I am. And she sprung into action, and like gets everybody in the room and all of that. And she's trying to tell me to stop pushing. And so obviously I'm not going to listen to that. Like, we're doing what we're like, what's happening is happening kind of thing. She kind of gets me into the bed. I actually didn't want to get into the bed, now that I'm thinking about it. I wanted to just stay in the position that I was in, which I was standing. And I remember her being like, you can't have your baby standing up. And I was thinking in my head, I'm like, yes, I can. I've seen it happen plenty of times before.
You're like, I've caught babies standing up, so I'm actually aware that I can't do this if I want to. But she seemed really intent on getting me into the bed, so I was like, fine, I'll get in the bed. So I got in the bed, and I'm on my side, and I'm pushing some more, and she's trying to tell me to stop pushing. And at this point, I'm just like doing what I need to do. It's so funny to try and tell someone who's had a baby vaginally before and is unmedicated to stop pushing. I'm like, that's like the most thing that is never going to happen the way that you want it to.
The thing is that like, maybe I could have tried to make her happy, and I could have tried to stop pushing. I'm sure most patients probably do when asked to stop. But I just knew like that would be absolute misery. And like I'm already miserable. And so I'm not, sorry, I'm good. So I kept pushing, and she was like really urging me to stop, because she's like, we need to check your cervix and stuff. And she was like trying to say, well, your cervix might be in the way. And in my mind, I'm just like, I know 100% for a fact my cervix is not in the way.
You can feel when babies are moving down. When you're unmedicated, and you're like, it was a
weird feeling.
I know that the baby is moving down. Like they don't do that when there's still some cervix.
Yes. And it, like I said, it was a very strange feeling too, because I remember, I think I've described this to you before. It felt like there was a balloon blowing up inside of my vagina. Like it felt just like that. But it also felt like a balloon being like blown up by cement that was actively hardening as it was blowing up. And I was like, whoa, this is a weird feeling. But you know what? when I actually like really got to put oomph behind like the pushing or whatever, which by the way, they never checked me. They wanted to check me to make sure I was 10 centimeters, but they could just see what was happening eventually. So once I actually really kind of started putting some oomph behind the pushing, it took like 90+% of the pain of those transition contractions away.
Yes.
It didn't, like, people have told me that, oh, you know, it gives you something to work against. And I'm like, okay, so like the contraction pain is there, but you're distracted by being able to like work against it. No, that was not my experience.
Yeah.
It was a complete, it took the pain away.
Yeah.
Like it took it away. It didn't exist as much anymore. There was some pain there, but the pushing itself was like actually like relieving.
Yeah, I hear that a lot actually,
then,
that like that people feel like it actually takes the pain of the contraction away, and like the pressure is really intense still, and like the stretching is intense, but like the contractions don't hurt anymore once you're like allowed to push. And I feel like that surprises people because people are so scared for pushing. But for a lot of people who don't have an epidural, it's kind of like their favorite part because they're like, well, I got to be done with transition and end that for myself.
Yeah, no, it was wonderful.
Yeah.
It was seriously wonderful. And I had wished, I think at that point, that I had stopped pushing, or that I had like started pushing when I first started holding my breath.
Yeah.
And started like bearing down a little bit because, you know, as pretty much, as long as you go without pushing, you know, that you're still feeling the sensation of those contractions, those transition contractions, until like you really start pushing, and then it kind of takes it away. So yeah, a lot of that improved. But then at the same time, my pushing efforts were very effective because I was unmedicated and because it was my second baby. So my baby was coming down very quickly. So that like transition pain that had been relieved was being replaced very quickly with like the stretching pain, which is a totally different sensation. Totally different. And frankly, like looking back on it now, I honestly don't even remember how bad it was. I just know it was. I just know it was really, really bad. But I like, my memory has been wiped as far as like how terrible that pain was.
Yeah.
It was very scary. You do feel kind of like you're being ripped in half a little bit.
Yeah.
And then like the actual crowning part, I remember, actually I don't remember, but I knew it was bad because I have videos of myself. And I listened to the sounds that I was making during that. And I was like, oh my gosh, it's good that I don't remember.
Yeah. Yeah.
Because it was intense. And I always want to like push my babies out nice and slow, because the number one thing that prevents people from carrying is pushing their babies out super, super slow. So yeah, I got to that end and I knew exactly where he was because you could feel everything, and I knew that he was like ready to be born. And I wanted to push him out slow, and I tried, but at one point I was just like, nope, I'm done.
Yeah.
That was slow enough.
Yes.
It's time for him to come out. And yeah, he was out, and the pain just completely disappears. I mean, it's just completely gone, and you're like back to like being a totally normal person.
Yeah.
I do remember though, like the transition from going from like being unmedicated, giving birth, to like back to normal person is a very intense like transition. And it was really trippy. Like, I described it to my husband at that time that it felt like I had been dropped in the middle of like Vietnam, like bombs going off. I'm in the jungle, you know what I mean? And it was like I was in this war, and I'm surrounded by all these people. Like, all the people that were in the room for my baby's birth they weren't there, but they were like watching.
Yeah.
Like, they were watching from a safe distance. You know what I mean? But they weren't there. So I'm like, I'm in the war alone, and I'm like taking cover from the bombs alone, but I can see their faces like almost behind a silk screen or something. Like, they're there, but they're not, and
they can't
there,
like come rescue you.
And so it's like, exactly. And that's exactly what it was like. It was like, you're like, feel like you're, you know, going down, you know? But then there's these people, but they're completely unable to like pull you out of it. And so then, you know, after the baby's born, you're like snap back to reality, and you're there in the same room with these people again, and you actually feel like you're not alone anymore. Like, you're surrounded by people, and you're all in the same sort of dimension again, you know. But then it was like weird, because it was like I'm surrounded by all of these people that were there, but they weren't there. Like, they were present, they saw what was happening, but they weren't there with me. You know what I mean? I was 100% alone.
Yeah.
And like it was so weird because I'm like, I feel like I just had like I'm in shell shock, and my hormones are like all ablaze, and none of the people in this room understand
Yes.
it. None of them are
Yeah.
even close to getting the feeling of what I'm feeling right now. And I think a lot of that feeling was because like birth is crazy, but I also think part of it might have been feeling like I feel like if maybe I had a really good doula,
Yeah.
or if I had just somebody who like really got it, I don't know that I would feel so much like I was alone. You know what I mean? Like I think it would have felt a little bit like I had some backup.
Yeah,
in Vietnam
totally.
and everything.
Yeah.
But I think part of it was like, even though my nurses and the midwives and everybody in there was so wonderful, like none of them were bad. But like they didn't get it. I mean, I think at one point, like I was on the bed and I was on my side pushing, and they like sort of took my legs and my hips and tried to square up my hips so that I'd be like square on my back. And they did that while I was in a contraction, and it was honestly the worst part of the whole pushing process. It was so painful, and honestly, more so than it was painful, it was a little bit like, I don't know, I just felt gross about it. Like I was like, don't do that to my body.
Yeah,
you know what I mean? Like don't
moving your body
manhandle
for you
me
instead of being like, let's.
Yeah, I was fine where I was. I was just pushing on my side, you know, like I was pushing on my side in the bed where you guys wanted me to be. And, you know, they went and did that. And I remember kind of like feeling the shifting of my baby's head in my pelvis. Yeah. And it hurt. And it was like, it felt like it was like the pain wasn't the thing that bothered me, though. It was like more just that, like, don't do that to me. You know what I mean?
Yeah. It feels like violating to have somebody move your body for you.
It was. So I do think that like that feeling afterwards maybe came from feeling a little bit lack of like support that I could have used. And I didn't blame anybody for that, but it did kind of bring into some perspective, like from, you know, for me as a midwife being like, okay, how do I help this person not feel like they're in the middle of a war zone alone? You know what I mean? How do I make it feel like I'm not present, but yet also 1,000 miles away at the same time? That was kind of cool. So honestly, like after all of that was said and done, like, I'm happy that it ended up the way that it did. I don't know that I would have chosen for it to go down that way. Like I still,
like if anesthesia was in the hallway,
my birth,
you would have invited them into the room. you wouldn't have chosen.
I think so.
Not to have
Yeah,
them
I think
in.
so. I mean, like that's what my plan was, and like that's what I would have done. And what I have now that I've experienced the unmedicated birth, like it was cool to have done that, but like I didn't really feel, I think, that sense of accomplishment that I think a lot of people feel with choosing an unmedicated birth. And I love that people get that sense of accomplishment, and I think they deserve that sense of accomplishment. You know, people say, oh, you don't get a trophy. It's not about that. It's about like the way that you feel and how powerful you feel. And like I felt a little bit of that, but if I'm being honest, I think just for me as a person, that's, I guess, not where I got like a lot of my satisfaction from either of my two vaginal births.
And I think so much of the satisfaction of that is, I think people almost think that it's coming from the fact that you didn't get an epidural, as opposed to that it's coming from the fact that you like had autonomy in that process. And you had autonomy in the process to like choose an epidural, and then you got that taken away by not being able to get it in time, by people moving your body for you. And then like that takes away from that thing that people think that they're getting from not having an epidural. It's actually about being able to make choices.
You know what? That's exactly what it is, because I will say the bit of satisfaction that I think that did come from having that unmedicated birth, even though it wasn't what I had originally planned, was just being like, wow, I didn't need anything. Like there was no assistance that I needed. Like I didn't need any intervention. I didn't, like, you know, people did cervical checks and they moved me and they did things or whatever, but I didn't need any of that. Like I would have had this baby and the baby would have come out safe. And obviously that's not the case all the time, but in my situation, after the fact, hindsight, I'm looking at it and I'm like, my body did 100% of that all on its own without any help. And that was kind of cool. And my husband actually cried, which was kind of nice, because I've always made fun of him because, or not made fun of him, but I've been annoyed with him because I've always wanted him to cry at special events. So like at our wedding, he didn't cry. I was pissed about that. And then when our twins were born, he didn't cry. He said he was too nervous. He was too scared. Okay, whatever.
You're supposed to at least fake it for me, for my sake. Come on.
I know. I'm like, cry some happy tears. And then my daughter was born, and I'm like, okay, well, this wasn't as scary, right? So like, why didn't you cry? And so we didn't cry with hers either. And finally, this fourth birth, he cried like a lot.
Sweet.
And I didn't see it at the time, but I saw it on the video afterwards, and we were talking about it, and I was just like, so what like caused you to cry? And he just said it was such an intense experience, and obviously seeing you in pain was a lot, and so there was some emotions from that. But also he just was like, I just gained not like a new respect, because he was like, you know, I saw you do it with Lorelai, obviously, but you know, I saw you go through this whole experience, and like just how he was trying to say like how powerful women are. And he was talking about how like back the way he said it was like back, you know, in like caveman times or whatever, like men, you know, were supposedly supposed to be able to like, you know, work the land and like produce food and like, you know, do all of this cool stuff. And he's like, I can't do that as a modern day man. Like I can't go and hunt a buffalo and drag home a buffalo for you, but you can do what women for all of eternity or whatever have been doing. Even now, like you have like maintained your, you know, sort of like intrinsic power or something like that. And so he was like just totally smitten just by the whole idea of it. Which is kind of cool.
And I think it is like really a thing to witness unmedicated birth, and I think you can like hear about it and watch little clips and videos of it like as much as you want, but until you've actually like been there watching someone, especially someone you know, go through it, it is like so infinitely more intense. I mean, I haven't had any kind of birth, obviously, so like I don't even know, because I'm disconnected from it, but even just witnessing it, it's like so much infinitely more intense than you can imagine. And it is like very, very powerful to watch people go through that. And then exactly what happened to you, which is like then they're just back all of a sudden after the baby's out, and you're like, you are the most superhuman person that has ever existed. And I still feel like that. And you do feel that way. I mean, it does feel like very powerful. Like, I needed nothing from anyone to do this. And so there is like that contrast between the two, where, you know, with the epidural, I had a very peaceful, it was very peaceful. Like that's how I would describe that. It was just, I mean, I hated the purple pushing. That was miserable. But like overall, there was no fear. It was just like peace and just excitement. And I got to meet my baby, and I got to soak that in. And it was just everything was quiet. Like the world went quiet, and it was wonderful. And with the medicated birth, I was like I said, I felt a little shell shocked, but it was exhilarating. Yes. You know what I mean? So it was like two very positive experiences, but completely different feelings with both. Yeah. Fascinating. And then what was it like bringing that baby home? You have like a million things going on, and you have 3 other children that you're taking care of. Like the jumps between your numbers of children. What was that like postpartum? Yeah, you always hang out in the hospital when you have multiple kids at home. You're like, maybe like an extra vacation. Night I need, I think. I know. Because newborns are like so chill, and oh my gosh, they're so sweet. Yeah. I love the newborn phase. They're so squish. Some people don't like it. Like the waking up every 3 hours, but frankly, like I don't know, it doesn't even bother me that much. Like, yeah, I'm tired, but I don't know, it doesn't even bother me anymore. Like I almost kind of like love it. I'm a little addicted to it. I don't know. But coming home with the baby was very cool. My daughter, I thought that she was going to be super jealous, and she ended up being possessive of the baby and like jealous of anyone who got to hold him. So that was interesting. I thought she was going to be like jealous of the baby, but no, she was jealous of anyone else. She's jealous of you for having a baby. So. Yeah, exactly. So to curb that, I started calling the baby her baby. I was like, oh, here's your baby. You know? That's helped. I've been to some like postpartum visits where they're older toddlers, and like the toddler opens the door and they're like, do you want to come see my baby? And I'm like, Yes, can't wait.
Yeah.
It's
It's her
cute.
baby for sure. But we were also kind of like in the process of moving a lot, so that was a little bit stressful.
Yeah.
The big thing that like kind of characterized my postpartum experience with him was just some breastfeeding troubles. Like obviously I went through the breastfeeding troubles with my twins that were mostly what we call iatrogenic, which means that's caused by the medicine or the medical establishment.
Right.
In this case, the NICU kind of made it difficult for me to breastfeed my babies. And by the time I left the hospital with them, they were just like not primed for that to be our success story, but we made it work. But with Everett, my newest baby, everything you would think would be like totally normal and perfect. And I got him latched on easier out of all of the four. Like he was the easiest baby to latch him on. He was latched on the first like 10 minutes after he was born. And so that, is really good for kind of like signaling to your body, that you need to help me establish my milk supply and bring the milk in. And then 3 days went by and my milk really hadn't come in yet. And then 4 days, 5 days, 6 days. That's a little weird, especially for a vaginal birth. Like you should have your milk come in probably by day 3 or 4 with a vaginal birth. So like now we're going on 6 days and my milk really hadn't increased much at all. It was still colostrum, maybe a little bit of transition, but not really. And volume was not there. And his suck was so incredibly painful. Like within the first 24 hours, I had blood blisters on my nipples, which hadn't happened before. He just had this really, really strong suck. And really painful suck. Like it was never not painful with him. And the lactation consultant was like, oh, well, he has a bit of it was a lip tie. And so we were trying to stretch that out and I was trying to correct it a lot and everything. Anyways, 6 days goes by and my nipples are tore the heck up. They're absolutely inoperable pretty much at this point. Like I was waking up and I was just like sobbing like through every feeding session. I wasn't able to tolerate it. And so it was getting to the point where I'm a very, very dedicated, I guess, person, or I'm stubborn. I don't know what you'd want to call it.
Dedicated is a really nice word to use, though.
I was not okay with like not letting this baby have breast milk when the other 3 did. I don't know. There was just something about that I was like, I'm not going to do that. But I probably should have, because
I was
it was
gonna
so
say,
bad.
like,
And my
for
nipples
anybody
were, like, really struggling.
listening, if you have blistering or bleeding or are at the point where you are dreading a feeding, it is time to like give your body a break, just pump and see a lactation consultant. It's gonna do more damage if you like push through.
Yeah, no, I damaged the heck out of my nipples, and I did give myself a break and said, okay, let's try pumping. But even the pump at that point, my nipples were so damaged that even the pumping was very painful.
Definitely.
And I could not figure out what was going on with my milk supply, because it was twofold. It was the terrible painful latch, and it was also this weird milk supply. And so I think it was like on day 7 that I had just like sort of like a big gush of like bleeding and a whole bunch of extra bleeding on like day 7. And then my milk supply came in after that. And I think I had a little bit of retained something.
Yeah.
So when you have a little bit of placenta, or even just the teeniest, tiniest little sliver of amniotic sac still inside of your uterus, it can cause an inflammatory response. It causes your uterus to maybe not get as like toned and hard to help prevent postpartum bleeding. And I did have, probably more bleeding those first 7 days leading up to that point too. And so I had that big gush of bleeding, and I think that was my body kind of getting out whatever it is that was still in there. Because when you have a tiny little piece of placenta still inside, it can produce hormones and tell your body not to, create your milk supply. And so I'm pretty sure that's what happened.
Yeah, interesting.
And why my milk supply hadn't come in. So yeah, my milk supply probably really got established closer to day 8 or 9. And so 9 days of just tearing the crap out of my nipples, and my baby being pretty hungry, because like I said, my volume had gone up a little bit, but not significantly. Not enough for him. And so what I kind of figured out, I think what was happening is there is a little bit of a mechanical difference in how to extract milk when it's a colostrum than when it's like true milk, because colostrum's a lot more viscous, it's thicker and stickier. So they kind of have to work a little differently and, you know, suck a little harder to get that out. And so I think that's what he was doing. And then as soon as my milk actually came in, his latch issues completely resolved.
Interesting. Yeah.
So yeah, I was like, okay, that was the issue. So yeah, I pretty much tortured myself for like 9 days.
Horrible.
And then we were good.
That's good. Well, I'm glad that it like actually fixed itself. But to the people out there, don't wait for it to fix itself. Go see someone and like get help.
Yeah, definitely don't. Yeah. And I did see a lactation consultant
Good,
too. So definitely see a lactation consultant. Don't just assume that something like my situation happened. But yeah, I mean, at 5 days postpartum, your milk supply hasn't gone up. There might be something going on.
Totally.
Me and my midwife brain didn't even consider that. I was just completely puzzled as to why it's like 5 days postpartum. I'm like, I didn't have a C-section.
Yeah, you didn't like have a giant hemorrhage or anything that would like cause it to take a long time. Yeah.
It was totally normal. Everything was totally normal. Weird. Yeah, I think that's what it was.
That would make sense. And then you've talked a little bit about like your mental health struggles in the postpartum period, like with the twins and all of that, when that was like craziness, which totally, you know, makes sense kind of to anyone postpartum, but especially when you have that much going on. But can you talk a little bit about how that was for your last 2 pregnancies, where like the pregnancy and birth and all of that was really straightforward still?
Yeah. So, I mean, I think with all of my pregnancies, I had a little bit of postpartum depression, but I didn't really know or notice it as much or really know what it was, because I had also a lot of other things going on after every single one of my births. You know, with my twins, I had started a business and it was obviously very stressful. And then we had the breastfeeding issues and all of that. So I was crying a lot every day and just struggling a lot. But I very much attributed pretty much 100% of that to like just the lifestyle changes and just issues I was having with things. And then with my daughter, like I said, I had just been, you know, sort of failed out of my program. Related to all that nonsense with my pregnancy and whatnot. And so I was kind of in a depression from that a little bit.
Right.
And I decided I was going to open up this like store for my company, which is actually totally just a way for me to like put all of my mental energy towards something. Yeah. It was a very, like not logical decision. I was just literally just like trying to like not be sad anymore. Yeah. Anyways, so I did that. And so I think, so I struggled. I was pretty miserable postpartum then, because I mean I was hurting in pain and I was like doing all of this crazy work and picking up boxes and doing all this stuff. But I think like putting my mind towards something made me feel less sad. And then with my most recent one, I think that was the worst like postpartum depression I've ever had. And it was very clearly postpartum depression. And, you know, part of that could have been that I was still kind of having some other struggles. Every time I step away from my company, it feels like my company tries to go down. So, you know, in this case, I'm like postpartum and, you know, I'm not able to do all the things that I was doing before I had my baby. And my company was on fire and I kind of put me in a really bad situation where I had to be like days postpartum and try to fix things that I really just couldn't fix. So I mean I was kind of left high and dry. Like I had 2 employees that quit at the very last minute right as I was going on maternity leave, and then they left me with like essentially a house that was on fire that I had to try to put out, and I couldn't because I was postpartum. So that was stressful, and I was really struggling. I was crying like 3 times a day and I just couldn't get out of it. And I mean I think if I hadn't, you know, kind of turned it around and reached out to some people for help and whatnot, then I would have probably let my company go down and, you know, which is just not like me. I never let anything fail. I'm very stubborn, like I said. But I got put on some antidepressants. This was the first time that I actually got put on an antidepressant for postpartum depression. So I started taking one of those pills and I felt a little better. And then I had to take another one. So I felt like I had to take a lot of this medication just to feel okay. But it was a totally normal dose. I don't like to take a lot of medication. But I'm really happy that I did because I mean, it totally changed the game. So I definitely support anybody who, you know, is struggling with that. You know, if you're anything like me, like I did not want to take any drugs. I'm just like I don't know. I just feel weird not thinking it's going to help, especially when you're feeling depressed. Everything feels like it's not going to work, but it does. It really does work.
And it doesn't have to be like a long-term solution. I think a lot of people are really concerned that if they start taking medication, they'll like never be able to get off of it. And that's not necessarily how it works for everybody. And if you are feeling like you need more help and you're already seeing a counselor and you have support people in your life and all of that, it's very, very important to like be open to at least having that conversation with your providers, because it can be, like you said, a game changer, but it also can be life-saving. Well, thank you so much for sharing your birth stories with us. It was really fun to kind of hear the like actual deep dive of it, because I think like I've seen all your videos on social media, and I know that like we talked about this most recent birth like pretty soon after it happened, but it is really fun to get the like deep dive and behind the scenes of all of that kind of stuff that we maybe don't get privy to otherwise.
Yeah. I think it was really cool for me to have kind of capped it off with like, oh, I've gotten to feel a little bit of each one.
Yeah.
And now I do feel like I have a little bit more understanding of how bad that C-section incision hurts and how, you know, intense it is to come back from an unmedicated birth where you're like in the throes of it and then all of a sudden everything's normal again. So
definitely.
Yeah, I'm happy that we got to talk about it.
Thank you for being here, and we will see you all next week. Bye.